Thank you for choosing the BNMS YouTube channel. My name is Simon Hughes. I work as a consultant in radiology and nuclear medicine in Birmingham in the United Kingdom. This is part of the applied CT anatomy course for PETCT and SPECTCT reporting. This presentation is part of the BNMS YouTube channel collection. The information provided in this presentation is the responsibility of the presenter and does not represent the views or opinions of the British Nuclear Medicine Society. Content is provided for education and training purposes and should not be interpreted as medical advice. If you have concerns about this presentation in any way, then please contact us directly and we will be happy to investigate further. This is the second part of a review of the CT anatomy of the brain for PETCT and SPECTCT reporting. Here we begin with an axial unenhanced scan through the level of the body of the lateral ventricles. Please review part 1. The lateral ventricles contain cerebrospinal fluid, which is low attenuation. The body of the lateral ventricle can be seen by the red arrows. If you click, these will appear. The inferior horn of the lateral ventricles is indicated by the yellow arrows, and the occipital horn can be identified on the left side by the green arrows. Widening and dilation of the lateral ventricles can be a sign of diffuse and focal atrophy when reviewing the CT scan for dementia assessment. If you click, the light blue arrow will indicate the site of the choroid plexus within the posterior aspect of the body and inferior horn of the lateral ventricles. These are slightly higher attenuation than the remaining brain due to the high density of blood. This is where CSF is produced. The two purple brackets show the beginnings of the superior part of the occipital horn. Remember the clear definition of the parietal from occipital lobes on the lateral aspect of the cerebrum is unclear. The dark blue long arrow is indicating the superior part of the calcarine sulcus. This is the sulcus within the primary visual cortex and is an area of intense FDG uptake in normal brains, and we shall review that again later. The two light green arrows indicate the anterior and posterior aspects of the central sulcus, and again note the high density sagittal venous sinus containing blood. The brown oval shows the splenium of the corpus callosum. In this slice, we have an unenhanced CT scan of brain at the level of the floor of the lateral ventricle. Note the two red arrows showing the central sulcus. Posteriorly, this is slightly more ill-defined, as the sagittal venous sinus begins to decussate into the two sigmoid sinuses. The orange arrow indicates the low attenuation of the CSF within the anterior aspect of the body of the lateral ventricle. The yellow arrow indicates the fornix, and the pale green arrow indicates the superior aspect of the thalamus, and these form part of the floor of the body of the lateral ventricle. The red oval indicates the position of the body of the caudate lobe. We will see that this is a prominent focal area of basal ganglia FDG uptake. The darker green arrow shows calcification within the choroid plexus. This is a common finding, and again indicates the position of the choroid plexus at the junction of the body of the lateral ventricle, occipital horn, and the temporal horn, indicating the trigone. On the enlarged central structure, we can see with the pale blue arrows the two paired internal cerebral veins. This is the drainage pattern of the central part of the brain rather than through the sagittal sinuses. The paired central veins join together to form the great vein of Galen, as we can see the position with the dark blue arrow. This is going to pass over the superior aspect of the superior vermian system to drain into the inferior aspect of the sagittal sinus. The purple arrow indicates the position of the pineal gland that we saw in the very first slide. The brown boxes indicate the quadrigeminal cistern, again that we saw in the first anatomy slide. And the red box indicates the superior vermium cistern with the great vein of Galen running superiorly and the vermis of the cerebellum inferiorly. On the next slides, with the red arrow, we can see calcification within the habenular commissure. This is one of the deep white tracts within the brain used to define the anatomical plane. Posterior to the commissure is the quadrigeminal cistern within the red oblong, and we can see the lateral recesses indicated by the two yellow arrows. If you click again, you'll see two green arrows. This indicates the position of the trigone of the lateral ventricles. This is where the inferior horn, the occipital horn, and the temporal horn meet. The light blue arrow with the next click shows the septum pellucidum. You might remember this from one of the first slides in Brain 1 lecture. The septum pellucidum divides the anterior aspect of the bodies of the lateral ventricles. We also see the posterior part of the sylvian fissure, indicated here by the two dark blue arrows. The deep matter, the grey matter deep to the sylvian fissure, is called the insular cortex. On the next unenhanced axial slice through the brain, we again see the septum pellucidum, indicated by the red arrow. Notice the division of the septum pellucidum, forming the cavum septum pellucidum. Adjacent to the septum pellucidum on both sides are the anterior aspect of the bodies of the lateral ventricles, indicated by the orange arrow, and the anterior horns of the lateral ventricles, indicated by the yellow arrow. If we magnify some of the central structures by clicking again, first of all we can see the head of the caudate nucleus adjacent to this anterior aspect of the lateral ventricles, and indicated here on one side on the right by the white oval. Adjacent to the head of the caudate nucleus on this slice is the anterior horn of the internal capsule, indicated by the two light green arrows. If we click again, the two dark green arrows indicate the posterior horn of the internal capsule. The internal capsule is the descending aggregation of the corona radiata that we've seen on the previous lecture. This is a vast bundle of white cells which is going to descend through the cerebral peduncles to form the pons, the medulla, and the spine. The two red ovals show the right and left thalamus. These appear to touch but are not actually connected, and this apparent touching is called the massa intermedia. This obliterates a part of the third ventricle, which we can see with the light blue arrow. The white bracket on the small magnified portion of the brain shows the position of the quadrigeminal plate, and this is going to contain a right and left superior colliculi, these are important regions when assessing quality of FDG brain scans, and we shall see this on one of the other lectures. The low attenuating fluid-filled region, indicated by the two dark blue arrows on the main image, indicates the quadrigeminal plate cistern, one of the basal cisterns of the brain. Within the yellow oval, we can start to see some of the folia of the cerebellar hemispheres, which are analogous to the folded gyral surface of the cerebrum. The two purple arrows indicate the position of the torcula. This is the meeting of the sagittal sinus within the central reflections of the dura, and the meeting of the straight sinus, which is going to drain the two great veins of Galen from the central parts of the brain. There is this torculate will then divide into both the right and the left lateral sinuses. In these cartoons we can review the production of CSF. CSF is produced by the choroid plexus within the lateral ventricles, which we have seen on previous CT scanning. The flow of CSF occurs from the temporal horn of the lateral ventricles via the trigone and occipital horn and inferior horn into the body of the lateral ventricles. The lateral ventricles are then going to drain into the slit-like third ventricles with its central vasa intermedia. The slit-like third ventricle is going to drain via a aqueduct into the fourth ventricle, positioned between the pons and the cerebellum. And then the CSF is going to drain in via the foramen of Luschka into a network of basal cisterns. We have seen some of these cisterns already. For example, the quadrigeminal plate cistern, and it is the flow of CSF from these cisterns into the subarachnoid space that is going to bathe the surface of the brain. The flow of CSF is also down into the spine. The CSF will then be reabsorbed via arachnoid granulations into the sagittal sinus of the brain and into the venous system. This unlabeled slides is an opportunity for you to review some of the anatomical structures we have already learned, including the grey matter of the frontal lobes, the deep white matter of the frontal lobes, the septum pellucidum and the cavum septum pellucidum, the anterior aspect of the body of the lateral ventricles, and the anterior horns of the lateral ventricles, the adjacent head of the caudate nucleus on both sides, the bilateral anterior limb of the internal capsule between the caudate, head of caudate nucleus and the lentiform nucleus, which we will review next. We can see the posterior limb of the internal capsule with the inferior aspect of the thalamus on either side of the slit-like third ventricle. We can see the quadrigeminal plate containing the right and left colliculi, and we can see the quadrigeminal plate system. We can start to see the cerebellar peduncles forming the early pons, which we will review next. On this slide, we see both the complete view of the brain, and if you click, you will see a magnified view of the central brain structures. Click again, and the two white ovals show the position of the head of the right caudate nucleus. The two red arrows indicate the position of the anterior horn of the left internal capsule. The anterior horn of the internal capsule lies between the head of the caudate nucleus and the lentiform nucleus, indicated by the red oval. The medial aspect of the lentiform nucleus is the globus pallidus, and the lateral aspect of the lentiform nucleus is the putamen. These are not distinguished on the CT scan, but the putamen shows intense FDG uptake, and the lentiform nucleus does not on the FDG PET-CT of the brain. The purple arrow indicates the posterior limb of the left internal capsule, and medial to this is the pulvinar of the posterior thalamus. The yellow arrow indicates the inferior part of the third ventricle. The two white brackets indicate layers of alternating white and grey matter extending between the lentiform nucleus and the sylvian fissure. These layers are external capsule as white matter, the claustrum as a layer of grey matter, the extreme capsule as a layer of white matter, and then the insular cortex deep to the sylvian fissure that we have already seen. The green arrow shows a branch of the middle meningeal artery as it courses through the sylvian fissure. The two pale blue arrows now show the right and left inferior colliculi of the quadrigeminal plate, with the inferior aspect of the quadrigeminal plate basal cistern seen. On this slide, if you give the first click, you will see the red arrow showing the inferior aspect of the anterior horn of the left lateral ventricle. If you click again, you'll see an expanded view of some of the more detailed central structures. The orange arrow is indicating the anterior and inferior projection of the floor of the third ventricle. This is the supraoptic recess and is going to contain the tuber cinereum, the stalk of the pituitary. The light green arrow on both images indicates the interpeduncular basal cistern and the two darker green arrows indicate the position of the left cerebral peduncle. The light blue arrow on both images shows the position of the right posterior cerebral artery as it arches in front of the cerebral peduncle. The right and left posterior cerebral arteries are derived from the basilar artery that we'll see more inferiorly. We can see posterior to the cerebral peduncles the inferior part of the quadrigeminal plate cistern, and posterior to this we can see the two red oblongs showing both the right and the left superior cerebellar peduncle. The two dark blue arrows show the proximal sigmoid sinus. This is a continuation of the right and left lateral sinuses, which were formed from the division of the torcula. Within the white oblong, we can see the right sylvian fissure, and the purple arrows indicate the tortuous branches of the middle cerebral artery within the sylvian fissure itself. At this level, the two red brackets indicate the right and left frontal lobes. These are now distinguishable from the adjacent temporal lobes and right and left cerebellar hemisphere. This is because of the dural reflections showing us the anterior, middle and posterior cranial fossa, and we shall review the dural reflections later. The red arrow within the magnified central structures shows the position of the anterior communicating artery, and the yellow arrows show the right and left anterior cerebral arteries. These are branches of the internal carotid artery, which is going to form the anterior cerebral artery and the middle cerebral artery. And we can see the middle cerebral arteries coursing towards the sylvian fissures on both sides. The light blue arrow shows the basilar artery. The basilar artery is coursing upwards from the prepontine cistern into the suprasellar cistern, and then dividing into the right and left posterior cerebral artery. The dark blue arrow shows the pituitary stalk, a continuation of the grey matter protrusion of the tuber cinereum that we saw previously. Between the two purple arrows, we see the cerebral peduncles coursing inferiorly and coalescing to form the pons of the midbrain. Within the two red ovals, we can see the right and left temporal horns of the lateral ventricles within the temporal lobes. With this cartoon, we shall review the circle of Willis and the connections between the anterior and posterior circulations of the brain. The anterior circulation of the brain is provided by divisions of the internal carotid artery as it exits the cavernous sinus on each side. The largest division is the middle cerebral artery that we have seen coursing laterally and whose branches are within the Sylvian fissure. Smaller branches are given off by the right and left anterior cerebral artery that we saw on the previous slide, and these are connected by the anterior communicating artery that we also showed. Smaller posterior divisions of the internal carotid artery project posteriorly within the suprasellar cistern. These will form the posterior communicating arteries and connect to the posterior circulation. The posterior circulation of the brain is derived from the right and left vertebral arteries that we shall see later. These combine to form the basilar artery, which ascends within the prepontine cistern and into the inferior aspect of the suprasellar cistern. And this is going to divide into the right and left posterior cerebral artery that we saw previously arching in front of the cerebral peduncles. The communicating arteries are common sites for aneurysm formation. That finishes part 2 of Applied Anatomy of the Brain for PETCT and SPECTCT reporting. This is made available on the BNMS YouTube channel. Please proceed to part 3.